Let's get started. So, Jesselly, you are a considerable force when it comes to mental health, a certified clinical social worker, as well as being certified in family therapy. You are also a very strong advocate and organizer. You served as the former president of the Latino Mental Health Association of New Jersey. Can you tell us a little bit about this work?
For sure. Thanks for having me on, Jeremiah, to talk about this very important topic, mental health. This is something that is very near and dear to my heart. I am someone who, is a loved one of people with mental health issues and diagnoses. So something I grew up with. So I'm very passionate about people getting quality care, particularly Black and Brown communities getting quality care. So I really had no idea I was going to be a social worker. I kind of was just going through the motions of things. But I had been meeting all these people with this social work degree, and they were talking about mental health. So, like, and mental health policy and how to get more bilingual mental health practitioners. And I said, you know what? I think I might want to do that. I might want to join that workforce. So I went to social work school in like 2007, which I realize is now a very long time ago, and at Rutgers. And I started there. I started working in I worked at an HIV AIDS clinic in Newark, providing group counseling and individual counseling. Also doing like house visits for people who lived with HIV AIDS. Um, and then I worked at a community mental health center, working with child welfare programs. And then I worked in a juvenile justice center, juvenile justice program, and outpatient community mental health. So pretty much anywhere where I could see patients who needed therapy and needed someone to do it in Spanish, I really enjoy that work the most. And I did that for many years, about 12 years. And yeah, I got trained in, I really believe in getting the best quality care. I don't think that I don't like that stigma about like because people are poor, they typically get less quality care. I was part of a Medicaid grant system, a system that saw people with very little income or very low income families. And I believe that they deserve the best quality care um, possible, regardless of it, whether or not they could pay. So I really went out of my way to get training in evidence-based practices that work for the community. So I got trained in family therapy, play therapy. Um, I'm also trained in EMDR, which is for trauma, mostly everything that is geared towards trauma treatment. EMDR, TFCBT, which is trauma focused cognitive behavioral therapy, and also, working with forensic populations. So my particular clinical interest is working with people who have been affected by sexual violence. So I really love that work. I think it's really important. I think it's just as important as your physical health, if not more.
Yeah. Well, you touched on your work in trauma field as well as emergency services, as well
Mhm.
as assault. So, can you tell us a little bit about your time where you served as the clinical director for the sexual assault program in Bergen County?
Oh, sure. I was the clinical director for the YWCA of Northern New Jersey's Healing Space, which is Bergen County's Sexual Violence Resource Center. They used to be called back in the day rape crisis centers. And I did the clinical supervision for their staff, uh, who provided services to people, uh, who were at different points of disclosure. I mean, it was completely anonymous. It's really meeting people where they're at. Before that, I worked 5 years supervising a child sexual abuse program. So I saw child survivors and their non-offending family members as well. And really, that work is very rewarding. It's really difficult to see people, um, to listen to stories of like horrific violence. Like this is stuff that's like the darkest side of our humanity. And it's really hard to kind of bear witness to people's stories about that. But actually, what's even harder is listening to how other people, and systems respond when these horrific acts come to light. Unfortunately, survivors are not typically supported. It's not like they walk into a police station and it's like, oh my gosh, how can we help you? Right away, like, oh, let's give you a warm support, or you must be scared, or it's immediately kind of like, you know, well, are you sure you said no? Are you sure that it was assault? Are you sure that you weren't consenting? Did you have a previous relationship with them? Had you complied? Like all these kinds of things that really insinuate disbelief, that the people aren't typically believed. And very few times, regardless of like what people believe, there's this big myth about, oh, someone can just say it and that's it. It's true. But that's actually not true. The research shows that actually convicting people for sexual crimes is really difficult, and the prosecution is very low, has low rates of prosecution, because it's actually really hard to prove in court. So typically people don't ever see justice. They never have real true justice for the things that they survived, because of the way the criminal justice system is set up. It's not really intended to support survivors.
Yes, yes. Now I have a personal question. So
Sure.
in your emergent services that you offer mental health crisis screenings. Can you tell me a
Yeah.
little bit how that works?
Yeah. So, people can be in a mental health crisis, and so how this works in New Jersey, I mean, even though they're trying to change it nationally, I mean, I'm sure you've seen in the news recently about the young man in Patterson who was having a mental health crisis and was shot by police. And unfortunately, the primary first responders to mental health crises are police. They're not trained to do so. Um, and obviously they're a little skittish around people with mental health crises. So typically people call 911, they call an ambulance, or get brought to an emergency room. So people in mental health crises get seen just like people in medical crises in an emergency room. And I would go and screen them, basically assess to see whether or not they were a danger to themselves or others. And they could be a danger to themselves by, having actual thoughts and plans to kill themselves, suicidal ideation, or because they are like in a psychotic state, like they may not be thinking correctly, like they might be hearing voices, or having beliefs that aren't really based in the actual reality around them, like paranoia, or kind of seeing things that aren't there, even though that's actually pretty rare. And I would evaluate them, or they have done wishes to harm other people, right? Like because of their mental state, that they're actually a risk to other people. So like they could be also very aggressive, making threats and things like that. So I would evaluate them, with some basic interviews very carefully, choosing my words very carefully. I've definitely been cussed out a number of times. I've definitely had conversations with, people calling me Lucifer and Satan and all that kind of stuff, or just refusing to see me at all, because they're so paranoid and untrusting of the world around them. And I would, work with the psychiatrist and the emergency room staff to determine what the best course of action was, which was either to admit them into an inpatient unit voluntarily or have them involuntarily committed, which is essentially hospitalizing someone against their will, because they are so much of a risk to themselves or the community. Very, very difficult work. You also see a lot of domestic violence. You see a lot of child abuse. You see a lot of, um, breakup stories, alcohol, things that happen under the influence, a lot of alcohol and drug abuse as well, because sometimes, people use substances and it doesn't sit right with everybody, the amount or whatever it is that they took. So they kind of have some mental health crises. But yeah, you see a lot of things that I've heard, a lot of stories that, it's never boring. I would say it's never a boring job. And just when you think you've heard every kind of thought or experience that someone could have, like someone comes with something else, and you're just like, okay, I thought I had heard it all, but now this is really me hearing it all. Yeah.
Yeah. Do you believe that clinicians or therapists should be incorporated in that first response team when it comes to these situations? Do you think that impact could be better for the survivor?
I do think so. Um I think that mental health crisis is a public health issue. That mental health is a public health issue and not necessarily a police issue. You know what I mean? I think that it would be better if we had kind of trained mental health professionals to de-escalate things that were non-threatening, because when someone's at a heightened state, they're very scared. And when people are working from fear, they can do some really crazy things. So having an understanding of that is really, really important, I think, to working with people with mental health crises, which is why I think, not to say that all police are ineffective. I've seen some really excellent police officers who, like, they just know the community, right? So they know how to talk to certain people because they actually engage in community policing. But not everybody does that, and there's a lot of stigma. You see, I think it's always so interesting because as a mental health professional, like when I first started my training, I didn't realize how exposed I was to people with mental health diagnoses and having mental health crises until it was like through my training, because I would just think, oh, that's just someone being mad. And it's like, no, that's not someone just being mad. That's someone who's in a manic state or a depressive state and needs like emergency psychiatric help. And I didn't have that understanding, you know what I mean? Because we always have these like cultural ways of explaining things because we don't trust systems, right? I mean, systems have typically been used against us. So I think a lot of Black and Brown communities have a understandable mistrust of systems. So I think it's very dangerous actually when police officers go to mental health crises and situations, even like sexual assault, because I don't think they are at all engaging in a process where they have they're like asked to have awareness over their life experiences and how that impacts the work that they do. So for example, like if you grew up in a home with domestic violence, right, how does that impact you when you are entering a space with domestic violence, right? Or if you yourself have been a survivor of child sexual abuse and you're meeting a survivor, if you're not healed and you don't believe, like, you know what I mean? You're in your own stage of denial naturally because there is no right or wrong way to deal with that. But you would project that, right? You would project that onto someone, um, and see them as dangerous or actually cause harm. So I actually think that having police respond to some of these mental health emergencies is actually really, really very dangerous and can be very harmful, and as we've seen, deadly for many people. So I do think it should be someone who's trained to kind of at least have looked at themselves enough to know how to address situations with people without causing harm. I don't think that's the oath that police officers take, in terms of getting to know themselves so that they don't cause harm, even though they take an oath to protect. But mental health is very taboo in police officers because immediately they'll lose their rights to be on duty, you know? So I can't imagine them responding. I could imagine them having a really hard time responding appropriately to those situations because um it's really outside the scope of what they're trained to do.
Now, you touched on stigmas.
Hmm.
Now, stigmas, along with inequalities, they play a
Yeah.
large role in mental health, just as you had mentioned, especially in the police system,
Yeah.
and definitely throughout government itself.
Hmm.
Can you tell us about the dangers of stigmas and inequalities, especially subconscious ones, because those are, in my
Yeah.
opinion, more dangerous.
Yeah. Absolutely. I do, every time I talk about stigma, I have a very specific way of talking about it because which is the opposite of how I was taught stigma. I was taught that people experience stigma towards mental health, right? So like communities of color, they stigmatize mental health, right? Like because, and you'll hear all these things. I've been to, oh, because they don't have these systems in their country. And it's like, wait, Yes, they do. There's mental health programs all over the world. The United States did not invent mental health, actually, but for some reason we have these myths that are really stereotypes and come out of colonialism and imperialism. So the way that when I talk about mental health and stigma, I always remind people that it is not people who stigmatize mental health. Communities of color are not taught to disapprove of mental health. That's actually not true. Um, it's actually systems that stigmatize Black and Brown communities because the mental health system is a system that was developed, honestly, to develop categories to determine what kind of behavior is normal and not normal. Now, you being a person of color can imagine what that actually means, right? When you're thinking about the history of slavery and the history of colonization and the history of sexism in this country, you actually see that in how these diagnoses are given out. There's a disproportionate amount of African Americans diagnosed with schizophrenia. Disproportionate of women diagnosed with borderline personality disorder, because what we're doing is really kind of labeling behavior and stigmatizing behavior to keep people in control so that we can keep these caste systems going. That's essentially what that's essentially what it was designed to do, even in terms of sexual identity, and sexual and gender identity. I mean, I believe that we still have need a diagnosis of gender dysphoria so a trans person can become who they really feel that they are. So, I always say it's never the community that has the stigma. We don't teach that there's no culture that teaches stigma. And there's no culture that completely just does not speak about emotional experiences. We do, it just doesn't look the way it does here because the system that was designed here was designed for social control and actually to stigmatize and stereotype communities and institutionalize them, criminalize them. That's essentially what a lot of these diagnoses are unintentionally used for.
Thank you. Thank you. I want to touch on another topic. Now, I see you have your logo in the background.
Yeah.
You're the current executive director of the Latino Action Network Foundation.
Yeah.
Can you tell us a little bit about the work you do there?
Sure. So the Latino Action Network Foundation is a nonprofit that focuses on policy research and outreach to Latino communities throughout the state. We do this through a network of partnerships with community groups and local nonprofits to reach communities on different policy issues. So mental health is actually one of our policy priorities. We released a report on Black and Latino mental health because we believed it was an important piece of healthcare that our community needs to be able to access. So we want to make sure that we have a say in how those systems are shaped to reach our communities appropriately. So that's essentially the work that I do at the Land Foundation. Is I really look at government systems and look for partnerships to try to influence those systems so that they are more effective in working for our communities and reaching Latino communities throughout the state.
Now, the Latino Action Network Foundation hosts an annual youth summit. Recently, they co-hosted with Voters of Tomorrow, New Jersey. What brought you to start this initiative or to join in it? So, what was the main focus in doing that?
There were two things. One was we were working on a school desegregation project where, our 501c4 organization, along with the NAACP, filed lawsuit to the state of New Jersey because of de facto segregation in New Jersey schools. So basically that we currently have a school system that children can only go to school where their families can afford to live. And we know what the racial wealth gap looks like in New Jersey, with Latinas being the lowest wage earners in the state, and essentially segregating those families into school districts that have less funding and less resources to provide educational equity to Black and Brown communities. So through that work, we do kind of doing outreach, kind of letting people know, like, hey, did you know about this lawsuit? Did you know about this lawsuit? And I don't know if I'm sure you're familiar with, like, Brown versus Board and Fuzzy versus Ferguson and stuff like that. And all the cases, there's actually so many, including one of a Mexican family in California, Mendez versus the state of California, on these issues. And these cases take like decades. I mean, this is something that I'm probably not going to see in my lifetime. So we really wanted to make sure that we had young people as ambassadors, students as ambassadors, to talk about this issue, because this is really going to be the fight, not of them, because you're clearly out of school, right? But of your children's children. And making sure that they're in a different school system and in a different setup than we were raised in. So that was our initial intent, is to make sure that we engaged young people in this campaign for educational equity. The other reason I did it was because I started as a young volunteer. I was like 21, 22 years old when I started volunteering for these kind of Latino civil rights organizations, just giving my time, doing things like running conference registration, right? Volunteering to do conference registration, or to, check coats, or I organized childcare for a parent conference once, brought my sorority sisters on and was like, let's take care of these kids during this parent conference, so I started that way. And I was, if I could think of, like, probably about 2 or 3 other people that I could think of, like, kind of around my age, doing that same thing at the time. And then I left. I started doing mental health work, right? I went deep into my career. And when I came back to Land and Land Foundation, I saw the same people. It was like the same exact people that were doing this work 20 years ago were still doing this work 20 years later. So they essentially had no young voices. They had recruited very little young voices to the table, very few. So I wanted to change that. I really feel like this kind of older, elder boys club is not productive. It's very old school, and I wanted to break that. I was like, this is everybody should be uncomfortable with this. So that really geared us to start to work with Voters of Tomorrow and you and Victor to really engage more youth in policy work and organizing and outreach and advocacy work, and having your own conference on your own issues and the things that you really feel are important, because that you're the future, right? Like, we're not going to be here forever. And what's the point of all the work we do if we don't create a legacy to continue it? And that's really something that is most important to me about the Youth Summit, is creating that legacy of people like, let's meet, let's organize, let's talk about this issue, let's influence it. These are the issues that are important to us, and this is how we're going to work together. And having that space to, like, hear from other people who are currently working on it, so that you can become involved and also have some of the history and backdrop to how to engage in that work. So that's our goal with that summit every year.
That's amazing. Making sure that there are youth at the table and there is a legacy to continue moving forward is very keen in the work you do and the work that a lot of people do. However, I do want you to know that I'm 16.
Oh, wow. I did not know that. You see, I'm not asking about age.
Yeah, my birthday is next week. I'll be 17. But yeah,
Oh.
um,
So you are
but
still affected by the system that we're talking about.
still fighting it, one zip code at a time.
Yep, exactly.
Well, my next question is, what's something that you've accomplished that you are most proud of? Or there can be multiple things. Something that really sticks out in what you've done, what you've, given a lot of time for.
So my two, um, so I would think, so I'm very proud of the people that I've worked with one-on-one in psychotherapy. I'm very proud to see, like I have had this, to me, it's like, I'm actually, like, agnostic. I'm not very religious, but in a sense, it is kind of like God's work. You know what I mean? Like, I've had these these beautiful moments of like seeing parents reunify with their children after having been taken away, of healing a family to support a survivor, to healing a family to hold accountable a perpetrator and still care for them in the aftermath of that, and while holding them accountable to justice. I've had the like the gift of seeing people really heal from horrible things and live good lives and be contributing members to society. And it's like so cool when someone tells me like they'll reach out to me and they're like 22, 23, and they're like, and I remember them when they were like 13, 14, and I'm like, wow, like this is like a person in college now who's like healing, having relationships, like they're living lives not perfect, but it could the outcome could have been very bleak if they didn't have somebody who kind of truly cared and didn't just treat them like a number, which unfortunately happens because it's like you're seeing so many people. But I kind of like I enter a meditative state when I'm in therapy with clients, and I just see the person in front of me, you know what I mean? And how seeing people heal has been honestly one of the best rewards in my career. There's nothing that can really top that. In terms of systems, I would say I was really proud of actually like locally in Hudson County, working to expand the program so that, families and victims can access a service appropriately, right? They don't have to wait a year and a half to see a therapist, which was the case. So I worked for program Project Safe, and I really worked really very, very hard to increase the funding for that program so that families could get quality care and I could actually access the care instead of waiting for services like a 1+ years, which was the case for many years before I was there. And I'm very proud to see that program still running that way, right? Like still up and running with a bunch of clinicians that I helped train and know my name and read the stuff that I wrote there and worked on. And they're kind of like continuing that legacy. So I'm very proud of that. And, I'm very proud of the work that we are doing at the Land Foundation. I'm very proud of my team, of the voices that I've brought to the table, and the voices that I've met through those people like you, at the table. So I really love that, the work that we're doing right now. I think that it's not so it's very, I'm very proud of it. It kind of, I guess because I was, grew up very poor and like family of immigrants, I'm very big on turning nothing into something. You know what I mean? Like, you don't got much, but you figure it out. And I feel like that's what we do with the Land Foundation. It wasn't much going on in the beginning, and now it's like this big organization with millions of dollars and tons of programs and doing all this great work, filing complaints with civil rights and all these kind of things, and putting and changing systems so that people are better represented in government and can actually access public services. So I'm really, really proud of the work we're doing right now.
Yes, yes. Everything counts. Every action, every initiative, every project, program, it all counts towards the bigger project, especially in mental health. There's not a lot of access to that. So making sure that there are all these different resources that anyone can go to, it all counts in the end. Well, I want to thank you for joining us here today. It is a pleasure to have you on the second episode of New Jersey Talks Back, Tea Time. Well, I look forward to talking with you again. Yeah, thank you.
Thank you, Jeremiah. It was a pleasure as always.